Infertility is described as the inability to conceive after a year or more of unprotected intercourse. Pregnancy is a man's sperm connect with woman's egg from one of her ovaries to become pregnant external icon. The fertilized egg must pass through a fallopian on its way to the uterus. Furthermore, the embryo must adhere to the inside of the uterus. IVF is not the best option for every infertile couple. It is the last resort. Natural conception is still the best option. This video will look at some of the causes of infertility and how utilizing a natural, holistic approach to resolving your infertility issues without surgery or pharmaceuticals. What caused the infertility in women? 1. Ovarian cysts. The ovaries develop small fluid-filled sacs called ovarian cysts. They're usually harmless, but they have the potential to rupture and cause excruciating pain. 2. Lazy ovaries. This simply indicates that an egg isn't being released when it should be. 3. PCOS, polycystic ovarian syndrome. When many small cysts are visible within the ovaries, this is known as polycystic ovarian syndrome. One of the leading causes of female infertility. 4. Endometriosis is when the uterine lining that would ordinarily shed as part of a monthly menstrual cycle grows on the outside rather than the interior of the uterus. 5. Fallopian tube blockages. Eggs will not be able to reach the uterus and sperm will not be able to reach the egg if tubes are blocked. Most women are unaware because there are no obvious symptoms to look for. 6. Recurrent miscarriage. Manually terminating a pregnancy on a regular basis can lead to infections, chronic pelvic inflammatory disease, fallopian tube blockage, endometrial damage, and uterine adhesions after surgery. What caused the infertility in men? 1. Low sperm count. Men younger than 39 have a 60% fertilization rate, while men older than 40 have only a 30% fertilization rate. Stress, impotence, and premature ejaculation, on the other hand, can all lower sperm counts. Substance abuse and smoking have long been known to significantly reduce sperm count and mobility. Saunas, hot tubs, high fevers, and even wearing underwear that forces the testicles to sit too close to the body's heat can produce temporary reduced sperm counts. 2. Male tube blockages. Tubal obstructions in the vas deferens or epididymis can sometimes cause infertility in males. Varicose veins in the testicles are the most common cause of male tube blockage. Some sexually transmitted illnesses, such as chlamydia and gonorrhea, can, nevertheless, produce blockages. After all the possible reasons, but still many couples for whom nothing specific can be found to explain why they are unable to conceive, it's labeled as non-specific infertility. Natural ways to try for pregnancy. 1. Fighting the depression. When women are under stress, testosterone is released into their bodies. Too much testosterone in your system can reduce your chances of releasing the right pregnancy hormones you need to get pregnant. 2. Toxin reduction and elimination. Massive amount of chemicals, toxins, and other poisons we are exposed to on a daily basis even in some of the cleaning products, such as shampoo, conditioner, toothpaste, and etc. 3. Avoid these foods when trying to conceive. Caffeine consumption can reduce your fertility rate by up to 50%. Some of the foods and beverages contain hidden amounts of caffeine like chocolate and soda. Always read the labels just to make sure there aren't any hidden caffeine sources. Sugary foods and beverages, such as sweets, biscuits, cakes, and carbonated beverages, should be avoided. Alcohol can also have a negative impact on your fertility. Remove it from your diet for at least 4 months before trying to conceive. The same is true when it comes to smoking. 4. Improving your health. Eating the right foods with the right amounts of nutrition, vitamins, and minerals will help your body to produce the right levels and types of hormones you need and respond well to infertility treatments. Taking a 30-minute walk or with a moderate exercise every day can improve your health and boost your endorphin levels. You might also notice that you're losing weight and having a lot more energy throughout the day. Drink plenty of purified water or good beverage like green tea. Green tea's antioxidants and amino acids can help you feel more energized. Each night, aim for 7 to 8 hours of sleep. Establish a daily routine of going to bed and waking up at the same time. Furthermore, improving your diet and lifestyle also to reduce the chances of ovarian cysts and menstrual cramps. 5. Add these foods in your diet when trying to conceive. Simple foods which low in fat and high in fiber and unsaturated fat such as avocados, oily fish, seeds, fruits, legumes, vegetables, and nuts, as well as lean meat, should be included in your diet. Finding foods rich in natural sources of folic acid and vitamin B. Folic acid can also help prevent birth defects such as spina bifida and reduce the risk of miscarriage. Green leafy vegetables, avocado, asparagus, papaya, broccoli, eggs, oranges, nuts, beans, and wheat breads are all good natural sources of folic acid and vitamin B. Zinc deficiency has been linked to decreased fertility in both males and females. Oysters, which are high in zinc, are also high on the list of foods to eat to improve fertility. Choose whole-grain high-fiber foods such as bread with seeds, brown rice, and pasta over white processed foods such as white bread, rice, and pasta. A well-balanced diet combined with moderate exercise will aid in the improvement of your overall health and hormonal levels. Besides that, the relationship and sex are important for those ready to conceive. It's best to have sex 2 to 3 days before you ovulate if you want to conceive. This is your most fertile period, and you have the best chance of becoming pregnant before releasing an egg. Basal body temperature kits and ovulation predictor kits, both of which are available at most pharmacies, can be used to predict ovulation. Or you can notice the most fertile cervical mucus discharged. It is a sticky, clear discharge that looks like raw egg white. It's important to have sex because this discharge helps sperm survive and swim to the egg more effectively. Even if the woman is at her most fertile but after only 1 or 2 days of abstinence, a male's sperm quality and quantity are lower. If you're trying to get pregnant, having sex twice a week, regardless of your fertility signs, can actually strengthen your relationship while also increasing fertility for both of you. Women who orgasm during sex have a higher chance of becoming pregnant. This is because the uterus spasmodic contractions can actually help pull the sperm deeper into the uterus. Try to keep the sperm in for longer, giving the sperm more time to swim up through the cervix and reach the egg. Allow as much time as possible for the sperm to stay in. There are a number of things you can do to enhance your health, minimize cysts and blocked tubes, and correct hormonal imbalances to increase your chances of naturally conceiving. On top of that, you'll be cultivating a healthy, receptive physique that'll be ideal for conceiving your own child. Best wishes for a successful parenting career.